Hey everybody, Nick Espinoza from the COVID-19 Cyber Threat Coalition here, and I have a very special guest for everybody today, and I think you guys are really going to enjoy this. I am joined by Keith Duemling. He is the Director of Cybersecurity for Technology Protection for the Cleveland Clinic, one of the best hospital systems here in the United States. And obviously we're going to be talking about the coronavirus, COVID-19, and cybersecurity. And so Keith, thank you very much for joining me here.
Thank you for having me, Nick. I'm greatly appreciative of the opportunity.
And we absolutely appreciate it as well. Now, before we dive into the whole nerd side of this, I want to know how the Cleveland Clinic is just doing, its staff in general, as it's holding up during this pandemic. I know that every hospital here in the United States is pretty much slammed. And how are you guys handling this?
I mean, as an enterprise, I think we're definitely banding together, doing what it takes to protect ourselves and serve the community as we always do. There's been an incredible amount of hard work by the caregivers who are providing direct patient care, and those in the operational support areas such as myself are incredibly humbled and proud to be part of it and support them to do what they do best every day.
Yeah, I have to imagine it's just a tough situation to be in right now, and so I know that I think people just around the world that are not in healthcare are beyond grateful for the front line. You guys are in the trenches, and so it is greatly appreciated. And I'm glad that you guys are holding up as well as you are. It's a tough situation. And with that, let's talk about the threats out there, because everybody talks about the healthcare side of it and what our wonderful doctors and nurses and practitioners are doing, but a lot of us don't really talk about the incoming cyber threat and how cybersecurity is keeping everybody protected. I mean, we've seen a complete rise in COVID-related threats basically getting out there. So what is the Cleveland Clinic seeing, and what are you guys doing to combat this as your title of Director of Cybersecurity for Technology Protection?
Yeah, I think that's a great question. I mean, we've seen a significant uptick in the amount of COVID-19 threats that have been targeted towards the environment. And probably the last, I think we noticed the big uptick in about 60 days ago, when we started receiving an increased amount of specific spear phishing and targeted threats. We've also seen a large rise in malicious websites that pop up and attempt to provide pseudo-useful information for our caregivers as they seek different ways to innovate and care for the patients that they see. So there's a lot of different threats coming in a lot of different vectors, and I suspect a lot of the individuals in the coalition are also seeing that as well. Yes. Most of them are traditionally via email and web, but then we're also seeing some very targeted scams, such as direct messaging via text, and then we've also received some abnormal items that have been sent to us under the guise of research and things of that nature. So there's a lot of different threats of different types that are coming at us, and we have to be incredibly vigilant in these times, because obviously a disruption in reliability and availability of our systems is a significant issue in these times, as it always was, but even more so now.
Yeah, and that's actually really interesting, because obviously here in the coalition, we are seeing an explosion in this as well. But the one thing that I don't think a lot of the general public considers is that if you are going to be targeting a hospital, you're not just targeting it with the generic World Health Organization or CDC kind of stuff that every user on the planet's going to get. It's more specific in the sense that if I wouldn't be getting research, for example, nobody would be sending me fake malicious research that would infect my machine. And I find it really interesting, though, because as you are seeing this uptick, we have to talk about the workforce. I mean, hospitals have a massive amount of employees, a lot of them, that are obviously on the front lines in the hospitals, in the buildings, dealing with, sick patients, but many are working remote. And so how are you balancing security and accessibility as you shift workers that can be remote, basically sending them home and having them remote in, obviously understanding a lot of different vulnerabilities with home networks and all of that? What's the Cleveland Clinic doing about that?
Yeah, it's definitely a complex situation. We're lucky that our CISO and our other executive leadership has long embraced a program of providing very specific training towards caregivers of different types. So we were lucky that we had that strong foundation to build on top of. But in the wake of the rise of COVID-19, we've been providing some additional enhanced education to our caregivers, some scenario-based situations so that they understand how to respond, enabling our service desk to assist caregivers as they call. And then we've also been enhancing our endpoint hygiene so that we make sure that all the controls that need to be in place are in place and are operating at an optimal state. So we're trying to leverage kind of a layered approach from a training and education standpoint, but then also a technology standpoint to really provide the protective controls necessary, both for those caregivers that are on site and those that have been reallocated to work from either other locations or work from home.
Right now, and I think that's actually a really good point as you're balancing that. But one of the things that has got to be super difficult is, you've got a lot of people on the front lines that have to use technology, and we're in the middle of basically a global wide emergency, if you will, onslaught of patients, onslaught of panicked people, and all of that. How do you start training and educating that workforce in the middle of them having to use the technology they've used every day to suddenly spot these phishing emails, to see these incoming threats and all of that? We're seeing an explosion of phishing attempts and everything that we talked about using coronavirus or COVID-19 as a lure. But when you've got that pandemic that's out there, how are you balancing that with education? That's got to be a tough thing.
Yeah, it definitely is. We have a lot of the traditional mechanisms to communicate information, but our organization is lucky that we have a tiered huddle process where individuals will meet with their teams on a daily basis through a stand-up mechanism, and they can provide observations that then percolate up through the environment and are delivered to the right individual to respond. And then we can also disseminate information down through the huddle process. So we're able to make an observation on a Monday, and then if it's well crafted and articulated by Tuesday, that information guidance on how to avoid those threats can be disseminated the next business day. In addition to that, we've set up a number of internal resources, briefing mechanisms, and other locations for caregivers to get that vital information so that they can continue to do what they do best without the threat of the cyber threats impacting their operations.
Yeah, and I have to imagine that's a Herculean effort, and the more you compartmentalize to send it down into these groups, it's got to be a lot easier to control that flow of information. Just if I'm thinking about, like, let's say a zero trust infrastructure, for example, now you've got groups that, let's say one group's not necessarily getting that message or learning as well as the other groups, you now have the ability to not have that spread across the entire hospital. Am I understanding that right in that sense?
Yep, that's an accurate.
Yeah, because you've got statement. I mean, how many employees do you know roughly that the Cleveland Clinic has or so?
We have around 75,000 individuals.
Wow.
Filling different roles.
Right. So
spread out throughout the United States and throughout the world too. So this is a global enterprise, and there are different regional threats that we also have to contend with.
Right. And you do everything from the frontline healthcare to also research, from what I understand as well.
That is correct. We have a very, very large research institute that we're very proud of.
Yeah. No, and I know it's one of the finest in the world, which is why I think it's such a thrill to talk to you here. And something you said a little earlier, interesting about that I thought was really interesting was, as you're securing this technology and, for this shift home and educating your users, one of the biggest problems that we have just in cybersecurity in general for getting healthcare is IoT, or Internet of Things. And I know that hospitals are just replete with various IoT healthcare equipment and all of that. As we are looking at, like, say, securing that down, I have no doubt that the Cleveland Clinic, under your direction, has got a lot of really good security policies for IoT in place. Has that really changed by virtue of the coronavirus or the pandemic in general?
Well, there's been a lot of scrutiny on IoT devices, and I'm lucky that there's a number of peers in cybersecurity. There's another gentleman who leads a group that their sole purpose is IoT security, and his group and my group work very closely together. But we've definitely worked hard over the last couple of weeks to put in additional visibility controls and then protective controls around some of the more sensitive IoT devices, so that we can, obviously make sure that any type of threat to them is neutralized before it ever materializes. But he's also worked significantly with our supply chain operations to make sure that we really start to embed cybersecurity into the DNA of the acquisition process, so that we're not trying to secure something after it's procured, but we're working throughout even the ideation phase and then the build phase and then beyond to really embed security into that from the get-go.
Yeah, and that's honestly great to hear because if you're looking at what a lot of the cybersecurity industry is talking about, specifically when it comes to frameworks like NIST and others, we've seen a huge rise in supply chain hacking, and some of your medical competitors, for lack of a better term, got caught up in the American medical billing thing last year and had a massive disclosure, and that's purely looking at your supply chain and not doing that due diligence and so having that vetting process, I think, for IoT is just a super important thing, and I'm really glad to see that
Yep.
you guys are on it. And with 75,000 users, I mean, I have to imagine you have an army of cybersecurity professionals and just nerds in general that are watching the barn.
We have a large number of very talented individuals, so we're definitely lucky. Cleveland, sometimes it's difficult to attract the talent, so we put a lot of effort behind building the talent local and investing in our people. Our people in cybersecurity are the best asset we have from a cyber standpoint because of their professionalism and their dedication to what they do. So really, it's the protection that we're able to provide is a testament to their efforts and their professionalism.
Yeah, no, that's great. That's really great. Plus, you also have access to the Cleveland Indians and the Rock and Roll Hall of Fame, so that definitely doesn't hurt.
Well, don't forget the Browns,
Fair enough. Fair enough.
Yeah.
Yeah, I just went to the Hall of Fame for the first time last year on a speaking engagement, and it was
nice.
super cool. Super cool.
Yep.
But anyway, I want to bring up one more thing too, because obviously, I'm here with the COVID-19 Cyber Threat Coalition, and what we are doing is we have about 100 million or so, roughly, indicators of compromise that we are getting on a daily basis, and we are working furiously to vet all of this kind of stuff, to supply it to hospitals. And so I'm curious to know if the Cleveland Clinic is fully using our block list, and what other kinds of sources for intelligence, how can groups like ours help somebody like or an organization like the Cleveland Clinic, to help maintain its safety and security and all of that?
Excellent question. We're beginning to phase in the blacklist and the IoT, the indicator of compromise list into our protective controls. We have a number of open and closed sources of intel that we leverage across a number of different technology platforms. But I think one of the most appealing things about the coalition is that it is a product agnostic group that has come together to share intel that is easily distributed. It can be used in many different forms and fashions, and it's a combination of what's observed by its members. So you have a distributed array of input points that then will continue to enrich and enhance the product that other individuals within the cybersecurity community can leverage. So it's a great effort, and I certainly am proud to be part of it. And I tip my hat to all those who came together to found this coalition, because it truly is a great cause to be part of.
Yeah, and I just have to say, from my own personal side, I was there, I want to say, within the first few days or so, give or take, of this being founded, and it has been amazing to see it and grow. And at 37-ish hundred members, we're all oftentimes from competing brands or technologies or services and all of that, and we all put that to the side. I'm not here as my own company. I'm here to help the world. And I'm so glad that, the Cleveland Clinic and others are starting to ingest this block list that we have, because this is pretty much, I think, a labor of love. And the nice part, I think, about it overall, and I don't know if this is your experience with the people that you work with, but just being in cybersecurity, at the end of the day, we're a service industry. We're there to help others. We're there to defend others. A lot of us could have gone the other way and got paid by the Russians, but no, we're here blocking these things. And I think that's a really good thing. And I'm sure your team at the Cleveland Clinic is no different than that.
Yeah, very much so. And one of the things that you touched on a couple minutes ago is a great point. This pandemic has demonstrated it's a situation where competitors need to stop competing and need to work together for the betterment of society so that we can get through this together. I know that statement is heavily used, but it is one of those situations where collaboration is the key as opposed to competition as we work to innovate in these challenging times. So, the work that you're seeing in a number of different manufacturing areas, to retool and produce ventilators and other critical healthcare equipment, regional groups of hospitals that were prior competing against each other, coming together and creating complex plans to share patient populations and provide the best care. These really are innovative times where, like instances we've seen in the past, over the past 100 years, difficult times sometimes bring us together and allow us to shine as an industry and as a nation. And
yeah, and
this is definitely one of those times.
oh, no doubt. I mean, and at the end of the day, it's ultimately, when you break it down, it's about saving lives.
Yep,
Right.
absolutely.
And so I am so glad that people like you are there on the front lines defending those institutions like the Cleveland Clinic that are helping tens of thousands of individuals daily with this. And so thank you so much for your time. I really appreciate this and everything that you guys are doing and taking the time to talk to me here on the, for the coalition and all of that. And if people want to follow you or get in touch with you or learn a little bit more, about you or the Cleveland Clinic, where should they go?
The easiest way to get in touch with me and stay in touch with me is LinkedIn. You have to be a little persistent sometimes because I have a pretty busy schedule, but I find LinkedIn is a great tool to stay in touch and share information. And then, I hope to continue to partner with everyone in the coalition and work together in these difficult times so that we can all get to the other side and be a better healthcare and a better, cybersecurity profession.
Right. Thank you. Well, I've been sitting here talking with Keith Duemling. He's once again the Director of Cybersecurity for Technology Protection of the Cleveland Clinic, which is pretty awesome. And so, Keith, thank you very much for your time. I really
Absolutely.
appreciate
Thank you.
it. Thank you. And if you want anything to learn anything about the Cyber Threat Coalition, you can go to cyberthreatcoalition.org and sign up, see our block list, read our advisories, and I encourage everybody to do that. And once again, Keith, thank you very much, and we'll see you next time. Take care.
Thanks, everyone. Be safe.